Alright, so I'm going to be talking about vitamin D. So, vitamin D is a fat soluble vitamin that is produced when the UV rays from the sun actually strike the skin and trigger the synthesis of it. It can also be consumed from diet, but not a lot of foods naturally produce vitamin D, or it's not found in foods naturally, really. Or a lot of foods, I should say, because it is found in a few, but the numbers are limited, so most of the time it's just from the exposure of the sun. So vitamin D promotes calcium absorption, and it is needed for bone growth and remodeling. And also plays a role in the neuromuscular and some immune functions, and also it plays a role in the reduction of inflammation. So without vitamin D, bones can become thin, brittle, or misshapen. So vitamin D is important for like bone strength and keeping their integrity. Um, for vitamin D, a diet or a lack of exposure to sunlight can cause deficiency. And actually, a fun fact that I found is that people with darker skin or an increased amount of the pigment called melanin actually have their skin has a reduced ability to produce vitamin D. So, unlucky me, right? So, another example or an example of a disease caused by vitamin D deficiency is called rickets, and it's most common in younger children when they're still developing, and it is characterized by a failure of the bone tissue to properly mineral, properly mineralize, resulting in soft bones and in skeletal deformities. So, make sure you get your vitamin D, everybody. Vitamin D toxicity can raise blood levels of calcium, which leads to vascular and tissue calcification, and that in turn can cause subsequent damage to the heart, blood vessels, and kidneys as well. So, some good sources of vitamin D include like fatty fishes. This would be your salmon, your tuna, and then also some other sources would include egg yolks and soy milk. So, in terms of clinical application, I would advise my athletes, like let's say I'm going into strength and conditioning and we're about to do some heavy lifting, I'd make sure that before we get into any of that heavy weight bearing, I make sure that my athletes actually have like decent amounts, like they're consuming maybe the fishes, the tunas, the salmons, getting their milk in, just to make sure that they are consuming that vitamin D and getting some of that calcium in there as well, just to promote that bone strength and just to reduce the risk of injury overall. Like the goal, I think, in anything involved in like exercising is injury prevention, because that can set a lot of people back. So we just want to make sure that they're getting this vitamin D into their diet and that it's promoting that bone strength that we want to keep. So that's my video, and I hope you enjoyed.